Hi, my name's John Kitchens, and I'm a retina specialist at Retina Associates of Kentucky and Eye Care Partners. And I would like to talk to you about your condition or your family member's condition. Let's talk a little bit about retinal venous occlusive disease, or RVO. Retinal venous occlusive disease is a condition where the vein in the back of the eye, either a small tributary vein or the main central retinal vein, becomes occluded. If you think about the eye like a sink, you have a faucet that brings fluid into the eye or blood into the eye, and you have a drain that drains the blood and the fluid out of the eye. And RVO is when your drain is blocked. It's important to realize this is not a stroke. The most common association with retinal venous occlusive disease is aging and hypertension. Your doctor will diagnose you with an RVO based off your clinical examination, an OCT scan that can show swelling in the macula and swelling of the optic nerve, as well as photos and possibly even a dye test called a fluorescein angiogram, where they inject some dye into a vein and it circulates up into your eye and they take a series of pictures. Most cases of retinal venous occlusive disease can be treated with intravitreal injections. The intravitreal anti-VEGF injections that we use are similar to the ones that we use for diabetic macular edema and for wet macular degeneration. We typically treat patients every month until their macular edema or swelling in the back of their eye resolves and the hemorrhages resolve, and then we slowly spread apart the injections as time goes by. It's critical to keep your follow-up appointments as you're receiving injections or follow-up if you have a mild retinal vein occlusion, as we're able to monitor you and see if the swelling is getting better, worse, or remaining unchanged. Your doctor will likely treat you with a series of injections. Those injections will, once again, reduce the macular edema, and in many cases will improve the vision. It's important to keep your follow-up appointments, however, as the doctor will look at the OCT scan, your clinical pictures, and do an examination to see and determine if your injection frequency is proper. They might extend out your injections if you're doing really well, or they might contract your injections, inject you more frequently if they see worsening swelling in the macular area. One of the things that's common amongst retinal vein occlusion patients is that they will have recurrent swelling as we try to slow down or reduce their number of injections. We'll monitor for this with OCT testing or retinal scans to see if we see worsening swelling. If we see that the OCT shows no swelling, we'll treat you and likely extend out your visits. Most people think that retinal venous occlusive disease is something that is typically resolved within 6 to 12 months. But in some patients, it can go on for years. We're treating you to reduce the swelling in the back of your eye, and basically we're waiting for new blood vessels to develop to bypass the blockage in the back of the eye. It's very critical that if you're diagnosed with a retinal vein occlusion and you have macular edema in the back of your eye or any blurred vision, to seek out care from a retina specialist. The retina specialist will diagnose you and will oftentimes apply intravitreal injections with one of the numerous anti-VEGF therapies that can make your vision better. One severe and uncommon complication from retinal venous occlusive disease is the development of abnormal blood vessels or neovascularization. Similar to diabetic retinopathy, as the retina receives less blood flow, and in this case from a retinal vein occlusion, it can grow abnormal blood vessels in the back of the eye that can get pulled on and can bleed and hemorrhage into the eye. They can also develop abnormal blood vessels in the front of the eye that can cause elevated intraocular pressure and advanced glaucoma. So even though your eye may not see well as you have a retinal vein occlusion and you receive treatment, it's important to maintain follow-up to avoid these complications. Thank you again for watching and appreciate your attention.